What is autophobia? What causes autophobia? How is autophobia treated? Let's learn more about it. Subscribe for more informative videos. Click like button if you like the video. And don't forget to comment your suggestions. Autophobia, or monophobia, is the fear of being alone or lonely. Being alone, even in a usually comforting place like home, can result in severe anxiety for these people, because they need another person or other people around in order to feel safe. Even when a person with autophobia knows they are physically safe, they may live in fear of burglars, strangers, being unloved, being unwanted, coming down with a sudden medical problem, hearing unexpected or unexplained noises. A person will develop symptoms of the disorder when they get into a situation in which they could end up alone. Symptoms of autophobia include obsessively worrying about being alone, experiencing fears of what could happen while being alone, feeling detached from your body when alone, experiencing shaking, sweating, chest pain, dizziness, heart palpitations, hyperventilation, and nausea when alone or in a situation where you could soon become alone. A feeling of extreme terror when alone or in a situation where you could soon become alone. An overwhelming desire to flee when you're alone. Anxiety from anticipating loneliness. Autophobia is an irrational anxiety that develops when a person fears they may end up alone. While there may not be an actual threat of being alone, the person may be unable to function normally until they no longer feel alone. When they are alone, they may feel a desperate need to end their solitude as soon as they can. Autophobia is a phobia, or fear-based disorder. If you suspect you have autophobia, you should visit your general practitioner. When you see a mental health specialist, they will perform a psychological evaluation. They will ask for your medical history to see if a physical problem is affecting your mental health. After that, they will perform a psychological evaluation. This involves asking lots of questions about your daily activities and feelings. Autophobia is considered a situational phobia. If diagnosed with autophobia, your fear of being alone causes you so much anxiety that it interferes with your daily life. In some cases, people have more than one phobia at a time. Being alone has a different meaning for different people. Some people fear being without a specific person, or sometimes any person, in close proximity. And the need for proximity varies from person to person. Some people with autophobia feel a need to be in the same room as another person, but for others being in the same house or building is okay. The need to be with someone else gets in the way of them leading a happy, productive life because they're constantly living in fear of being alone. If you think you have the symptoms of autophobia, rest assured that there's help out there for you. People with specific phobias like autophobia are often treated with psychotherapy. The most common types are exposure therapy and cognitive behavioral therapy. Exposure therapy treats an avoidance behavior that has developed over time. The goal is for this treatment to improve your quality of life so that your phobias no longer limit what you're capable of doing in your daily life. Your doctor will re-expose you to the source of your phobia over and over again. They will do this first in a controlled setting where you feel safe, and eventually will move to a real-life situation. In cognitive behavioral therapy, they'll use other techniques that help you learn how to confront and cope with being alone in a more constructive way. They will work with you to examine your pattern of thinking around your phobia. In most cases, psychotherapy alone is successful in treating autophobia. But sometimes medication can be useful in helping reduce a person's symptoms so that they can recover through psychotherapy. They may instruct medication for short-term. Some commonly used medications for people with autophobia include drugs that block stimulation caused by adrenaline in the body. This is a chemical that becomes present when a person is anxious. Benzodiazepine sedatives can help you relax by minimizing the amount of anxiety you feel. These drugs should be used cautiously because they can be addictive. This is especially true in people with a history of drug or alcohol dependence. With the right combination of treatments, you'll better learn to manage and understand your reactions, feelings, and thoughts. Thank you for watching. I hope it was useful for you. Please subscribe my channel for more informative video.